All right, so anyone dealing with male pattern hair loss, androgenetic alopecia, knows the search for something that actually works can be tough.
It really can.
Today, we're diving deep into finasteride. It's a real cornerstone treatment, but we're specifically looking at oral versus topical.
Yeah, comparing those two forms.
Exactly. The mission here is to kind of unpack the science, see how they really differ, and help you figure out, the key things to consider when making a choice.
It sounds good. And it starts with how finasteride actually works, right?
Yeah.
Because AGA, this hair loss, is driven by DHT, dihydrotestosterone. That's what makes the hair follicles shrink. Finasteride steps in and inhibits the enzyme 5-alpha reductase.
Okay.
So it basically blocks testosterone from turning into that stronger DHT. It targets the root cause.
Blocking the source. Got it. Okay, so with that mechanism, oral finasteride, that's been the go-to for a long time.
Decades, yeah.
What kind of results, what efficacy numbers really cemented its place?
Well, the data's pretty strong. Landmark studies, they showed a mean increase of about 107 hairs in the first year.
Wow, 107.
Yeah, significant. And maybe even more telling, over 2 years, 83% of men either kept the hair they had or actually saw an increase.
So for most, it's not just stopping loss, it's potential regrowth.
Exactly. That's why it became so established.
And that effectiveness comes from it working throughout the whole body, right?
Yeah.
The systemic impact.
That's the key. When you take the pill, it gets absorbed well, and it lowers DHT levels everywhere in your blood by about 65–70%.
Okay, system-wide.
Right. And that's great for hair follicles all over the scalp, but it also means it affects other systems. It crosses the blood-brain barrier, for instance.
Okay. And that leads us straight into the trickier part, side effects.
The necessary conversation.
While it works well, oral finasteride does have this known profile. What are the main concerns?
Well, the ones most talked about are sexual side effects. In trials, maybe 1.8% reported decreased libido, 1.3% erectile dysfunction.
Relatively low percentages, but still significant for those affected.
Absolutely. But maybe more concerning recently are the neuropsychiatric effects. Things like depression, even suicidal ideation, have been added to the FDA label.
That's serious.
It is. And crucially, there's this thing called Post-Finasteride syndrome, PFS.
Right.
Where these side effects, both sexual and potentially mental, can actually persist even after someone stops taking the drug.
They don't just go away when you stop the pill.
Not always, unfortunately.
Yeah.
And that potential for long-lasting issues, well, that's really spurred the development of alternatives like topical.
That makes total sense. So the whole idea behind topical finasteride is deliver it right to the scalp.
Target the area.
Maximize the local effect, minimize it getting into the rest of the body. Does it actually work as well for hair growth, though?
The evidence suggests it does, yeah. Efficacy seems comparable to oral. There was one big trial showing an increase of about 20 hairs versus just under 7 for placebo. And the researchers describe that as numerically similar to what you see with oral finasteride. Plus, it's often used really effectively with topical minoxidil, too.
So, similar hair benefits. But the big goal was less systemic exposure. How does it stack up there?
This is where they really diverge. With topical, the amount that actually gets into your general bloodstream, the plasma concentration, it's more than 100 times lower than with the pill.
100 times lower. That's huge.
It's a massive difference. Systemic absorption is tiny, like 1 to 5% maybe. So the side effects are mainly just local stuff, maybe some itching or redness on the scalp where you apply it.
And the systemic side effects, the sexual ones, the mental health ones?
Significantly lower. Often studies show those rates are similar to placebo. It's a dramatically different safety profile from a systemic point of view.
Okay, so pulling this all together for someone listening and weighing these options, what's the core trade-off?
It really boils down to this. For stopping hair loss and potentially regrowing hair, both oral and topical finasteride seem highly effective and quite comparable.
Similar results for hair.
Right. But when you look at safety, especially systemic safety and hormonal impact, that's where they're worlds apart. Oral gives you that high body-wide DHT reduction, which works, but carries those risks, sexual, neuropsychiatric, and the potential PFS issue.
Yeah.
Topical gives you effective DHT reduction where you need it, on the scalp, but with drastically lower amounts getting into your system. much, much lower risk of those systemic side effects.
So making that choice really comes down to personal factors, doesn't it?
Absolutely. You need to think about your own tolerance for risk,
Mm-hmm.
especially concerning sexual function and mental well-being.
Consider your medical history too, right? Like if you've had issues with depression or anxiety before.
Definitely. That's a critical factor. And then there's the practical side. Is the convenience of a daily pill worth the systemic risk profile for you compared to applying a topical solution, which takes a bit more effort, but seems to offer a much better systemic safety margin?
Right. So we've seen similar efficacy for the hair itself, but these vastly different impacts on the rest of the body.
Precisely.
So maybe the final thought for you, the listener, is this. As you think about your own situation, how do you personally weigh those benefits, the really effective hair treatment, against the broader systemic effects on your body and mind, especially now that a more targeted approach, the topical, is available and showing such promise?
Yeah, that's the conversation to have.
Definitely a crucial conversation to have with your doctor.